All right, we'll go ahead and get started. Welcome everyone to the More Revenue Community Pharmacy Roundtable. I'll be your host today. My name is Breck. I'm one of the co-founders of ServRx, and wshaw from my team will explain a little more about ServRx if you're not familiar with what we do, but appreciate everyone being here today. I absolutely love community pharmacy. I've had the opportunity to work with community pharmacies now for over 20 years, and grateful for that opportunity, experience to work with everyone in the industry. It's been my privilege, but love community pharmacies, and I'll do everything in my power to help them be successful. And so that's why we launched this roundtable, is to help our community pharmacies survive in a market that's really stacked against them. I think most of you are familiar with this Fortune report that talked about how many independents had to close. I estimate that just in the last 2 years, even since this has come out, there's been another 2,000 independents that close. So ServRx has partnered with all the PSAOs across the country, and so we get those updates and we see the closures, unfortunately. The big problem is that the margin is so much lower, right? So back when I first started in the industry, we had fair profit margins, about 35, 36%. Today, they're as low as 3 to 5%. And so it's pretty hard to stay in business with that really low margin. And then you also compound the problem with all of the payer community stacking up against community pharmacy. So I refer to them as the mafia. You've got the Cigna group that's aligned with one of the big PBMs, Express Scripts. Express Scripts is rolling more PBMs underneath them. So in work comp, which we do, a big one is MyMatrix is now rolled up under Express Scripts. Well, there's a direct alignment there with Cigna, and their pharmacy alignment is with Walgreens. So you can see how they're positioning themselves to drive community pharmacies out so that they can force all those patients to go to a Walgreens. Right there in the middle, you've got United Healthcare, over 65 million lives that are paying premiums into United, and plus the company's premiums. And when we had United a couple of years back, we actually, our company contribution doubled with what we were having to pay per employee. And so they're making literally billions of dollars just off the medical side, but they own OptumRx. OptumRx actually generates about 75% of their total revenue in United Healthcare. So just the claims processor is responsible for over 75% of their revenue. Their alignment isn't with a national chain. They're one of the, if not the largest, mail order pharmacy in the country. If you are on a maintenance medication, or if you've had an injury and you're going to have several refills to take care of that injury, Optum sends the patient a letter, and it reads as if their only option is to get their refills through the mail order. It literally reads like they don't even have another choice to go to a community pharmacy. They have to get their refills through their mail order. They're very aggressive on that. The patient literally has to make several phone calls to opt out of that automatic refill through their mail order. Okay, and then the last one on the far right is CVS Health. This is the first time in the history of payers that the PBM made so much money they bought the carrier. So Caremark is the PBM that's aligned with CVS. Even though CVS has 10,000 retail locations, selling anything and everything that you can think of, makeup, chips, soda pop, hair products, everything you can think of. Oh, and also they do dispense medications there too. But still 80% of their revenue comes from Caremark, or the PBM side. So that Caremark revenue was so vast that they were able to acquire Aetna. So the three major PBMs all aligned with the payers, and their goal is to put independent pharmacies out of business. So what can we do about it? not only do you have everything stacked against you, then you have this crazy thing called the direct indirect remuneration, a DIR fees, that all of our community pharmacies are very aware of. I did the calculation on this extremely horrible increase in DIR, over 91,000%. So I did the math on what it would cost me to fill up my gas tank in my car, because everybody complains about how expensive gas prices are. It would cost me over $70,000 every time that I filled up my tank, if this same increase applied to gas. The example used here is a gallon of milk costing $36,000. So again, the deck is stacked against our community pharmacies, and so many of them have closed their doors. Analysts predict that another 2,000 to 3,000 will have to close up shop this year alone. Here's some of the really sad stories of pharmacies that have been around for 80, even 106 years that ended up just having to close their doors. This is creating pharmacy deserts. Here's another list of some others that recently either sold their files or they had to close. And by the way, when they're selling, the independents selling their files to the chains, they're just getting pennies on the dollar. There's not a really good margin there for them. So that's not a good option either. I'm a firm believer that our independent pharmacies need to focus on getting at least 1/3 of your profit margin from non-dispensing programs. You can see, obviously, some of the others have done better, to the supermarket chains, mass merchandising pharmacies, and then your national chains. Our independent pharmacies need to move in that same direction. So we have some wonderful, going backwards there. We have some wonderful programs to talk to you about and how you can accomplish that. When I was a little boy, I got to play some Pee Wee League hockey. Spent some time up in British Columbia, Canada. So Scott, I'm one of those Canadians that came down here to get out of the snow. No, I actually was born here in Arizona. But I loved Pee Wee League hockey because you were indestructible. You had, more pads. I think the pads weighed more than the kid. So you were indestructible. But one of my favorite players was Wayne Gretzky, and when interviewed why he was such a great player, of course, this is his famous quote, that he skates to where the puck is going and not where it's been. We need to do that as a pharmacy industry. We need to go to where the industry is going and not try to stay in the status quo. I'm going to share a little quick explainer video about the ServRx program. If you're not using this program, it's totally free to you. You're probably already contracted through your PSAO, and you need to use it so that we can get you fair reimbursements every opportunity we can. Here's a little video for you.
An injured worker comes into your pharmacy. What do? Do they have a PBM card? Who is their carrier? Will I have to make a bunch of calls to find out? Will I get paid? And if I get paid, will it even cover the cost of the drugs? Don't worry, just send the claim to ServRx. They will do all the work, guarantee payments, and you will even make more. Less work and more money. What do you have to lose? You are probably already contracted through your PSAO. All you need to do is enroll. www.servrx.com.
And here for my team, I've got wshaw to tell us more about our program.
Hey, great morning, everybody. Like Breck said, we are out of network. We have no affiliations with the PBMs. This is a free service for your pharmacy, so there's no enrollment fees, no annual fees, no monthly fees. So my information is in the chat if you'd like to reach out, and I can help you get set up real easily. Okay. Now, for example, if a patient comes into your pharmacy, they need a meloxicam, for example, for workman's comp. And if you was to process that meloxicam through a PBM, your pharmacy may be reimbursed. This is generous right here, but we're saying, well, from what we're hearing from pharmacy, $3 to $4. Now, that same medication, if you was to adjudicate through ServRx as PCN, the reimbursements we're starting to see now for pharmacies is anywhere from $95 to $105. And if you are with a PSAO, that will be reimbursed to your pharmacy in 30 days through your PSAO Central Pay. And if you're an independent pharmacy, that will be reimbursed to your pharmacy directly from ServRx in 45 days. We do have a live help desk that's available 7 days a week. So if your pharmacy was to receive a rejection, you can feel free to give our help desk a call, and they will help the pharmacy receive that paid label. Again, we have marketing material that we can help promote the pharmacies, to let you know that that the pharmacy does handle workman's comp. And we also get mouse pads out to pharmacies as well. I know a lot of pharmacies like that. It's just a step-by-step guide with ServRx's BIN and PCN group number, along with our help desk as well. Again, this is a free service for the pharmacies, no affiliations with the PBMs. We're just here to help keep those fair reimbursements that the pharmacies legally deserve.
Thank you, Will. Appreciate that. And yeah, if you are not already enrolled, get enrolled. Even though you have contracts, a lot of you do have contracts with the PBMs. They kind of hold you hostage and make you go into network. So if you want the 65 million lives on United Healthcare, they force you to take their Catamaran, Cypress Care, all their other networks. So we understand that, but still, there's enough self-insured employers out there that 1/3 of all work comp can go through our program, and you can get these much higher reimbursements from us by cutting out the middleman. So really excited to introduce a brand new product. I got introduced to this product from another podcaster. A lot of you know Bruce Nealand. He's been in community pharmacy forever, longer than me even. Almost as long as Dr. Lewis, who's here today too. Also, he's been around for a while, but he does the Roadshow podcast on the Pharmacy Podcast Network, and that was where I first heard about. Well, I'm going to skip over the inset and go to. That's just an announcement, by the way. Here, there's a brand new inset, and I can send you the information on that. But this new product that I'm speaking of that was on the podcast was the nasal cleanse, and that's something that struck a chord with me because of how dry it is here in the desert, how dried out my nasal passage is, but then also I have allergies. And so I started reading up some of the benefits of this product, which is absolutely amazing and what it does. And then I hear about that in the surgical suites that there's issues with contaminating the surgical field, and it's coming 60% of the time. It's coming from the nasal cavity of the patient that's on the table. So really excited to introduce to you Dr. Gail, who's here to talk about the product that she has invented. So tell us more about this. This is an amazing product.
Thanks, Breck, and thanks for having me on your podcast. It was really interesting. If you don't mind, I want to take a minute to talk about and comment on your comments, if that's okay.
Please.
It was really interesting to listen to that because as a surgeon, we experienced the very same consolidation and control by the insurance companies as far back as 1994. And so everyone was running and jumping to get on these plans. And that was just like, moths to a flame. Because what happened was once everybody had signed on, then they really hammered the reimbursement. And it became virtually impossible to be in private practice. And so most surgeons wound up joining larger groups or hospital groups. And nowadays, it's almost impossible to find a surgeon in private practice. So I see a lot of analogous trends in the community pharmacy environment. And I think I was thinking about this last night when I was talking to another independent pharmacist who we love, Dana Gordon. And I was saying to him, look, the people that are going to survive are going to offer something to the patient that's different, right? You're going to offer them education about their medications. You're going to offer them personalized service. You might offer them compounded medications, which is truly a skill that the other pharmacies don't have and never will have. And I think that is where the puck lies on the field. I think that is the future. It's like the independent pharmacies have to distinguish themselves with something that is proprietary, that's unique, and that is sustainable. along with the other things as well, like the service that you offer. So in that light, we are actually joining with the independent pharmacists on a program that we're working with a pharmacist, Dana Gordon, as I mentioned, and Richie Ray. And Richie is a very entrepreneurial, independent pharmacy owner, and he has worked for years. He's down in Houston. He basically partners with local physicians like ENTs, dermatologists, gynecologists, and he really caters and customizes to their patients' needs. So he will do a lot of compounding in terms of specialized gels and then find unique situation. Let's take, for example, sinus surgery and treat that patient before their surgery with an antibiotic solution or a gel. Now that's where nasal cleanse comes into play. And what I learned as a surgeon is exactly what you said. The nose is responsible for many infections in the body. 80% of upper respiratory infections enter the body through the nose, and then they go into the lungs, right? And the same is true with surgical infections. So in 2010, there was an article in the New England Journal of Medicine that stuck with me. They did a study that showed if you decolonize the nose, you don't have to sterilize it, but if you decolonize it, then we can decrease postoperative surgical infections by 60%, as you said, Breck.
Wow.
It's a big number, right? And it's really important because surgical infections are disastrous and they're very expensive, and the patient never wins. So that brought us to this idea of developing something that was like a toothbrush for your nose. Because if you extrapolate that information to the general public, obviously, if we were cleaning our noses, we would all likely be healthier and we would spread less disease. So that's what we've done. We've created a nasal cleansing kit, which is a applicator. At the end of the day, can deliver any drug into the nasal cavity. I'll speak to that in a minute, and an antiseptic gel. It's also moisturizing, as you mentioned. And again, you can carry this. You can provide it for patients who are coming in to get sinus rinses or nasal rinses, patients who have allergies. And we recommend just putting it right there at the front counter where the patient checks out, because it is new. And we have a little display. There you go. We have a little display for you. I'm happy to answer questions. The active ingredient is 0.13% benzalkonium chloride. It is FDA registered as an OTC drug. And the margins, you'll be happy to know, are 50% at the recommended price for selling the product.
That is awesome. So it's the Keystone 100% markup that you need. So that 50% margin that our pharmacies need. What is the suggested retail price just for the patient side?
We have several different sizes. There is a 15 count, which is about a 3-month supply, and that's under $30. So it's $28 or $29.99. And then there's a starter kit, which is about 2 to 3 weeks supply, and that is $14.99.
Perfect.
And it comes in a mint and an unscented.
Excellent. That's an amazing product. I think the trial I got was the mint, and it's kind of it's refreshing.
Yeah.
Not overwhelming, but just really refreshing. So, Dr. Gail, if you'll please put your contact information up in the chat so that if people have need to know how to connect with you, that'd be great. Amanda,
Okay.
it's great to see you. You had a question for Dr. Gail?
I do have a few questions. Well, since it's FDA approved, is
Registered.
Registered? Sorry. Is it going to be covered on any Medi-Cal plans or any like Medicare Advantage OTC cards?
That's a great question. It's HSA and FSA approved.
Awesome.
Yeah.
Yep. Yeah, good question. Thank you. In the interest of time, please meet Dr. Gail in the chat for any additional questions. I know she's got to pop out a little early too with her busy schedule. Let me
Thanks
back
so
up.
much.
Yeah,
Thanks,
thank
Breck.
you. Appreciate you being here. Let me
Sure.
back up a little bit and go over this new NSAID real quick. If you want more information, this was sent over to me by Dr. Lisa Foss. The big claim to fame for this new NSAID is that it's a once a day dose. So it's a low dose, once a day only, and you can now also get this through your secondary wholesaler. So one of our big supporters of our roundtable and podcast is Real Value RX out of Texas, and they do have this in stock. So wanted to make sure that you all got that announcement real quick on the new NSAID. All right, there's a comparison. All right, next up, want to invite Scott Lampier to talk about ServRx. This is an amazing product that I personally use. I don't travel without it. Anytime that I go anywhere, I make sure that I'm protected with MyShield. In fact, the little handy wipes that I pull out are large enough that I can wipe down both of my grandkids with one sheet. So I do travel with my two little precious grandkids occasionally, and I know they're going to touch everything on the plane. The tray table, the seat belt, I mean, everything is their playland. And so I don't just wipe them down, I wipe the plane down as well, anything that I think they're going to touch. And I know it's safe because it's all water-based. It's not using chemicals to kill pathogens. It is using technology and physically killing the germs rather than chemically. So it's safe for their tender skin. So Scott, why don't you tell us more about ServRx?
So I'm going to say it, excuse me, anyway, the check is in the mail, Breck. The privilege I get with being part of this group is that we're making a difference in patients' lives, and I couldn't be more proud of the people we associate with here. And part of that is my mission is making a difference with these products. They range from hand sanitizers to sanitizing wipes to laundry care, wound care, just a whole wide range of products that are the sanitizers are all FDA approved, and I have 2 disinfectants that are water-based and are EPA registered. And basically what we're doing is we're taking the same rate of the benzalkonium chloride that Dr. Gail talked about in her product, and morphing that with a nanotechnology that creates a microscopic barrier basically on any surface that when a germ cell comes in contact with it, it gets pierced and starts to oxidize, and then there's a positive nitrogen molecule that finishes it off basically by electrocuting it. So there's nothing that gets used up. So these products last for hours and hours and hours. The FDA allows me to say 4 hours, but if they allow me to say 4 hours, you know that it's probably going to be a good deal more. I have several studies of how effective they are against things that we know and hate is like fentanyl. The wipes take care of fentanyl for hours and hours. So the same wipe as Breck was talking about, you can wipe your kids or grandkids or nieces or nephews' hands, arms, legs, whatever. Just don't eat it. And in their place area, because it's water-based, it doesn't evaporate like alcohol-based products. And those areas will all be free of germs for up to 4 hours. I don't know if you've really taken notice, but the hand sanitizer that we all hate, the alcohol content's gone from 50% to over 70% now. So when we first started doing this, it was generally you could find 50%. So they know the product's not doing what it's supposed to be doing, and so they haven't upped the active ingredient to kill the germs, and then it only lasts for as long as it's wet. So 20 to 30 seconds, you're out of luck. There's no more residual germ killing. So my telephone number is on there, my email is on the chat, and I'll be glad to talk about things. And for the pharmacy owners, I have a healthy profit margin in there, and it kind of gives new life to the situation. You can recommend something now instead of just treading water with the same old, same old. So I'll hand it back to Breck.
Thank you. Appreciate that. Yeah, again, wonderful product. Please put your contact information up in the chat so everyone can find you. You've got your new website up and running, right? So they can now
Yep,
order
that's
right directly from the website.
www.germsrx.com.
Yeah, please put your contact information up in the chat for everyone. All right. I didn't see John Casson here today. I just want to mention this really quick. This is a fantastic program that gives every one of our independent pharmacies their own Amazon store. So most of our pharmacies only can make a sell if you are open and a patient walks in the door. This program actually directs patients to you, so more foot traffic, and then provides them with an online store. These guys are so scary smart. I mean, they're the same technologists that developed WebMD, Yahoo Money. I mean, these huge international platforms that everybody uses today. So their SEO or search engine optimization actually knows what that patient was prescribed and then will market to the patient complementary products that go along with that. We need to get nasal cleanse up on that. I call it Amazon store, but it's just the equivalent of that for each one of our independents. If they do a price comparison, 90% of the time they're going to find it for a better value through RxSpark than they could even find it on Amazon. So not only are they directing patients to you so that you can make sales, you don't have to carry these products. They're all online, so they have partnerships with Henry Schein and DME companies. It's all of their products in your store, but it looks to your patients like it's coming from your pharmacy. So great program. You need to get enrolled with that. I'll put some information up in the chat. Also, if they're searching for pricing, if they're doing some price shopping, it's always going to put your pharmacy and just put your logo in the place of the MyRxSpark, because that'd be your pharmacy's logo. Just put that information, would be all your information in there. And so everything looks and feels like it's coming from you. But even when they're pricing different prescription medications, it's always going to put you at the top of that pricing list. I put the steps on how to get enrolled in there. I'll spam it a couple of times so you can see it's a really easy process to get set up and enrolled with them. And even if you don't have a website, they'll actually build the landing page for you. Super inexpensive process to get set up with the MyRxSpark. They already have 12 million patients enrolled, and some of them are like healthy truckers. That's kind of an oxymoron, but there's 3.5 million long distance truckers that may be passing through your community, and they need to pick up a prescription. So you need to get in this directory so that they can find you. So next up is a turnkey wellness in a box solution called Brim. If you have not heard about this yet, it is absolutely amazing. Absolutely amazing. This is taking it way beyond the tier 1 reimbursements that our pharmacies are eligible for. All the programs that I've looked at out there, including big, huge programs that are being provided, like Outcomes and others, they all load you up with more duties, and you don't have time for all of those duties. And then you still only get reimbursed tier 1, which is what a pharmacy is eligible for. Brim Wellness takes a lot of that heavy lifting off of you, moves it over to the clinic, credentials you on the medical side so that you're getting tier 2, tier 3, and even sometimes tier 4 reimbursements for those services. Example up here in the upper left hand corner. One of my clients did 10,000 flu shots last flu season. His reimbursement, now it's multiple stores, so don't feel bad if you only did 5,000. He has multiple locations. So did 10,000 flu shots in last flu season, was reimbursed $167,500. $400. So approximately $17 per flu shot. After we've set him up with the BRIM program, he does the same amount of work. It's almost $1 million. Okay. This is a wellness clinic in a box, turnkey. It's like kind of the Minute Clinic or retail clinic concept, but on steroids. It's part of the Team Up initiative with NCPA to bring all of our pharmacy partners together in one big collaboration. By the way, it's the fastest growing collaboration in community pharmacy right now. There's over 100 pharmacies that are already in the queue to get set up. In fact, there's so many that they're really only focusing on the pharmacies that already have clinical space built out. Eventually, they'll come in and help you build that out to the specs and everything that are needed. But right now, they're really kind of looking at the folks that already have this built out. Again, it's all inclusive, credentialing, even staffing for you, patient management, practice management, billing, collections, all collaboration. And the best part is the ROI is about 3 months. So it generates really great reimbursements. It is completely separate from your pharmacy, even though it's owned by the pharmacy. So you still own it, but you have a collaboration with your local physicians to have a community health collaboration, which is very, very popular and needed right now. Some of the key individuals that are involved in this, I want to point out Dr. Phillips right there in the middle. He's retired heart transplant surgeon, still very active and is on the board. He was on the very first transplant team here in the United States. Look him up, look up his credentials. Fantastic guy that even ran the NIH for a while. He was on the short list to run the FDA and went a private practice route instead. So wonderful people here. Michael Phillips, CEO, has run hospital groups, has built clinical programs for rural communities. And then Jason Kodish, we just call him Cody. Cody is wicked smart. When I presented the plan that I was looking for in helping our community pharmacies, in a day and a half, he turned around a complete business plan, identifying all of the revenue that could be generated for the pharmacy and also help patients at the same time. In Medicare, there's a real big push right now for CMS to provide more services that the PCPs don't have time to get to. Did you know that only about 20 to 25% of our Medicare patients get their annual WellCare checks? Do you know that Medicare would much rather pay for a WellCare check than sick care down the road? And so we're not getting to all of those WellCare checks because our PCPs only have time to take care of sick patients. So now collaborating with your local PCPs, you can do this service for them and share in the missed revenue that they weren't able to capture. It's a 3-leg stool approach. The BRIM Wellness Centers and then the managed services are the phase 1. Phase 2 is actually the talent exchange that, like I said, they will even staff your clinic for you. That is an amazing program. So you're not having to pay for a FTE when you only have part-time work for them. So they share that talent across the collaboration. And coming soon is the financing. This was my idea. Raise my hand on this one. I said, hey, we've got to have a mechanism to help our community farmers because they're all struggling right now. So this is a co-op that you can borrow from. And then as you're paying back the co-op, and remember I said the ROI was like 3 months. So it's really fast turnaround. But once you pay back the co-op, you're now a contributing member of the co-op. And now you're making interest on that money that's being lent to the next pharmacy, and you're helping the next pharmacy get set up. So you've got the revenue stream coming in from the clinic, and you'll also have a revenue stream coming in from the financial engine here as well. So pretty excited about getting that set up and going for community pharmacies. The initial program just starts out with the low-hanging fruit, which is your vaccinations, but now doubling or tripling those reimbursements. It's all the things that you're already able to do as a pharmacist in most states with test and treat, but now you're doing it on the medical side rather than the pharmacy side. That's breaking the ceiling of the tier 1 reimbursements. You're now getting into tier 2, tier 3. Wellness is what I'm talking about, where you're now doing the WellCare checks and then the hybrid telehealth services. We have literally mapped out the next 18 months worth of services to roll out to our pharmacy partners, and some really high-tech technology. Revenue in the first 36 months looks to be, whoops, take that back, getting a little ahead of myself, about 1.4 million for your pharmacy. So you can see that in year 1, year 2, and year 3. So 36 months equates to about 1.4 million. Legitimate program. This next piece I'm going to skip over is just one of the technologies that's being brought in, the first of its kind, that increases microcirculation. Our cardiologists can work with about 24% of the circulatory system. So actually the majority, over 70% of your circulatory system, are the little capillaries that they can't work with. This technology works with that, getting more oxygen and nutrients to the cells, taking the metabolic waste out, and improving, increases ATP by like 22% also. So total, could go for hours just talking about that one technology alone. Brim has that locked down as the only clinical provider for the first FDA approved class 2 medical device in that area. It is a fairly big commitment to do the build out. So that's why we're starting with the pharmacies that already have clinical space. But even if you don't have clinical space, the IPPN, anyone can start with this, because it takes care of the 2 main things that need to happen before you can even open your clinic: credentialing on the payer side and the collaboration. So the independent pharmacy provider network is for every pharmacy. Brim may not be for every pharmacy. You may not have the space, or you may not have the desire to get into clinical services. The IPPN, the Independent Pharmacy Provider Network, every pharmacy can be in this collaboration, and for a heck of a lot less startup costs, because it's all virtual. Those are active QR codes. Feel free to scan them with your phone. This QR code for the health risk assessment up here literally is a longevity test. If you can respond positively to the first 5 or 6 questions, there are some in-depth studies that prove that you will actually add a decade to your life. What patient doesn't want to have that tool available to them? Literally add a decade to your life if you can respond appropriately to the first 5 or 6 questions. If you cannot respond to those correctly, then you need to come into the clinic. We need to see you. And then the e-visit is the QR codes scheduled there. So wanted to give you those 2 opportunities to talk, to see about, but then the remainder of the time we're going to talk about, now that you have this new revenue streams coming to you, how do you keep more of it? How do you reduce your tax responsibility? And so we have an amazing program. I want to introduce first Dr. Lewis, Dr. DeMar, to talk about how to double your profits, and then give the remainder time over to Richard to talk about how they can help you reduce your taxes by 20 to 40%. We've actually partnered with a law tax firm, so they do both tax and law firm to accomplish this for you. So Dr. DeMar, do you need to share your screen? And while he's pulling that up, my free gift to you is, if you didn't get that scanned on your QR code, I'll give you in the chat, I'll give you the link so that you can take that health risk. Totally HIPAA compliant, so it's only going to be for your eyes or your PCP, your primary care provider first, and until we have enough of the Brim locations set up.
Thank you very much, Breck, for this opportunity. Great presentation today. And so again, as Breck mentioned, I am a well-seasoned pharmacist. I've been doing this now for 42 years, and have just transitioned over to working as a coach to help pharmacy owners, as Breck has shared, and even more alarming statistic in Pennsylvania. Community pharmacies are closing at a rate of 1 every 36 hours. And so from that standpoint, what pharmacies, community pharmacies, they're on the verge of extinction. And the problem is that affects rural communities even more so than urban areas. And so from that standpoint, that's part of my mission, is to really help at least 50 of those pharmacies in 2024 kind of turn things around. Because the thing is that COVID has actually given a lot of pharmacies a golden ticket and a second chance at being thriving and being profitable. And so that's part of what we're going to talk about today is, how do we, what are some ways to turn things around? And so what I'm going to show you is an approach using profits as opposed to revenue, and show you the power of profit acceleration. And it really, if you take away nothing more than that, you have to focus on profit as opposed to revenue. So if you can sell a compound for $1,000 versus trying to sell, 400 scripts, at $2.50, you better serve your patients as a result, because you're using less resources. And we'll talk about that. How to uncover tons of hidden profit that's hiding in your business, and show you how you can generate the same amount of revenue as $1 million company with 25% of the revenue. So you become more efficient at the resources that you're deploying. And as Breck mentioned, I can show you, and I'll show you right now, or in a presentation, how to double your current profit in less than 5 minutes. And we'll talk a little bit about that, why that's important. And to demonstrate the power of compounding, I want to take an example. Take a penny, and we double it every day for 30 days. And this is dated, and it's now May. If you do that, that would, within that 30 days, increase to $5,368,709 just by using profit acceleration. And it's just small incremental improvements can result in massive increases in revenue and profits. And to show you this, we're going to use Profit Acceleration Simulator. I also have the software where we kind of do a deep dive, if you schedule a time with me, to really look at several different areas and show you the power of profit acceleration. Don't know if you can see this, but you can follow along on my website. There's a simulator, and the URL is jdpconsulting.org/sim. So you can kind of put your own values in there. So let me go ahead, and here is a pharmacy that I've been working with. They have revenue of $2.3 million. Their gross profit margin is about 19%. A healthy pharmacy is usually got somewhere between 30 and 50% gross profit margin. And again, with a healthy pharmacy, they normally have a net profit margin of somewhere between 15% to 30%. And so from this standpoint, this particular pharmacy is struggling. And if you look at their profit, it's about $115,000. And really, that's the owner's draw. So from that standpoint, the owner's not even making enough. Well, he's not making a comparable salary to other retail pharmacists. Let's start with doubling your profits. We're going to pick two areas to do that, and it's going to be cutting costs and increasing prices. And the reason why we do that, these are not affected by revenue. Well, I take that back. Increasing prices is, but cutting costs is not, and it drops directly down to the bottom line. So if we take roughly about a 5% reduction in costs, and we take increase prices by 5.5%, we see that we more than double the profits compared to what it was prior to. And cutting costs, what does that really mean? So it's really looking at two areas. We're looking at costs of goods sold, and we're looking at overhead. And so one of the easy ways to do that is looking at who you're purchasing your drugs through. So can you consolidate and have one secondary vendor that you go to for all your generic purchases? And as a result of that, like for example, real value products, I've got a client that's going to achieve between 20 and 40% reduction. So they'll blow out that 5% cut in costs just with that alone. So looking at how you're spending money, and then secondly, increasing prices. Looking at like this particular pharmacy is a compounding pharmacy. And when I asked them, how do you determine your prices? He says, well, I just, we just kind of look at it and see, what other people are charging, and not necessarily looking at what their what their costs are, and then more importantly, what their margins are. So it's refreshing to see, that there are certain products, if you pick the right product and you've got a 50% margin, that you can really make some good money. And then likewise, with, programs like the BRIM, you can really do well. That's how you double your profit. And these other 12 areas represent kind of the low-hanging fruits within your business, where there's opportunity to achieve $200,000 in profits. And that's something that we delve into if you schedule a time with me.
Yeah, this is amazing, Damar. This is absolutely amazing. And so please put your contact information up in the chat so that people can schedule a one-on-one and really get into this in depth. Want to be sure that we give Richard enough time to cover tax reduction. And so if you'll stop sharing your screen, please, any questions you have for Dr. Lewis, please meet him in the chat. And Richard, let's get into, at least the highlights of your program, because the goal would also to have them do a one-on-one with you.
Absolutely. Very good. Can you see my screen?
Yep.
Okay, let's walk through that. I'll go really at a high level. Apologize for speaking quickly. We are late in the time. Move it along here. So basically, here's what the situation is. All of us, and I include my, I've had many companies, built many companies. We build our companies based upon what we input. Typically, over 94% of businesses, we set ourselves up as a sub S corporation, could be a partnership, or it could be or a sole proprietorship. The problem with that situation is that from a tax shelter standpoint, when we have a pass-through entity, which is what that is, your profits pass through to your personal taxes, we are paying taxes at the high level. The structure on this, every different kind of company has a different advantages, whether it's an LLC, whether it's an S, whether it's a C corporation. But the C had millions and millions of dollars able to be spent, which allows different shelters to be created for your C corporation, but not sub S companies. Their focus is doing what we do. Give our prescription drugs, manufacture our widget, do whatever. But we don't get that specialized tax treatment, that specialized tax allows us to be able to take advantage of the tax strategies that exist out there. Is probably doing a wonderful job for you, but they're typically focused on compliance. For that, just try to talk with them between January the 1st and April the 15th. They're doing what they're, but they don't have time to focus on tax strategies. There's over 74 pages in the IRS code. No one can be a specialist, just like you guys often specialize, as do CPAs, everybody else. So do CPAs, so do attorneys, and they don't specialize on taxes. A lot of different kind of tax breaks that you're missing. If you are a 2% or more owner of an S corporation, you are restricted by law from taking advantage of many of the benefits that you actually offer to your own. What we do, as I won't even go through the details here, the answer is we present Tax Law Associates. TLA is a specialty tax consulting firm, and for years they have specialized in working with the owners of pass-through entities, reduce their taxes. Our headline is that we typically reduce personal to 40%. It is very common for us to have reduction by $35,000, $40,000, $50,000 per year, because once you've implemented these strategies, last year after year after year, as long as the business lasts, because that's how we struggle. We've been doing this since started in 2002. We've got almost 4,000, all 50 states. Managing partner Mike Fussell, whom you would end up meeting if you decided you wanted to go through. Mike is an attorney. He's a master's of law and taxation. He's a member of the U.S. bar, and he is a CPA. I tease him about being an underachiever, but he's after his name and my entire name. And this is exactly what he has been doing for all of. There is a huge amount of the headline, as I talked about before, is that we're talking about 20 to 40%. Sorry about that. 20 to 40% reduction in your taxes. But in addition, and those come from many different areas. Again, don't have the time to go into it in detail here, but there are a lot of different areas you would understand and see what those were before you decided that you wanted to move forward on something like this. But there's a combination. What we deal with is we create a multi-entity structure. This is why you need the legal in there, because CPAs don't create legal entities. Attorneys do. So we structure your company properly so that you're able to take advantage of the tax strategies that exist out there. TLA does all of this for you. In addition to the reduction in taxes, there's a number of other strategies that they also look at. They review real estate holdings that you've got, asset protection issues, estate planning, succession issues, retirement planning, employee retention, educational planning. This is what the attorneys do, is they look at all of these areas, review it with you, and it honestly doesn't cost, because everything is being paid for by your tax reductions. But all of these areas, which are hugely important, now and or in the future, are also gone through specifically in this. We're not going to replace any. We're not going to replace any of your financial advisors, state attorneys, accountants, CPAs. We don't do those things. We don't. TLA does not sell insurance or do retirement programs or anything like that. They do strictly the advice portion of it, and they want to work with your trusted advisors. You love your CPA. We love your CPA. They need to be part of this, partner with all of us in order to make this happen. This isn't a retainer service. The service is a one-time fee based on your first year earnings. There's typically around 100% ROI in the first year. Over the 5-year period of time, you're talking about typically 1,000%, or some huge number like that. We're not going to be working in any of the gray areas. Everything we do is statutory, black and white, by the book. Mike is extremely proud of the fact that over 27 years, he has never been audited for his strategies. He's worked with other people in other audits, but not for his strategies. As I said before, you'll have reoccurring savings every year for the life of the business. We're working with Breck, and for all the pharmacies here, the TLA, the attorneys will do a preliminary analysis for you, showing your minimum tax savings before you ever decide that you want to go forward. You will understand what's happening. And if you have any questions on that, I'd obviously love to sit and talk, find out whether your organization fits the quality criteria, whether we can be of help for you. I put my email and my phone number in the chat, but here it is again. Richard, it's easy, richard@incentadvisors.com, and that's my phone number. Email me and we'll set up a time. I'm done. How about that?
Hey, you did great. Thank you, guys. And please put your contact information one more time up in the chat, both you and Damar, because we had some folks that may have not been here at the very beginning and they won't see the chat until after they arrived. To save the chat, which you're going to want to do, please, everyone save the chat. I'll do it as well, so that I've got a copy of it for you. If you haven't been able to save the chat, I can get you a copy of it. Just let me know. You just simply in the chat function, you'll see the little emoji area right to the far right of those little icons. You'll see more. It's 3 little dots. Just click on the more and then save chat, and that'll actually save it on a Zoom folder on your desktop. Or again, you can reach out to me to get that chat that has everybody's contact information. I want to thank Will from my team for presenting today, Scott Lampier for his amazing product, Dr. Gail with the nasal cleanse, and Damar and Dr. Damar and Richard for presenting us their programs as well. You can see collectively we can save community pharmacy with all these programs, and here to help you not just survive but then also thrive with these programs. So appreciate again everyone being here today. We'll open it up for questions. For someone that's just asking for the opportunity to record, I have this recorded and we'll share it with all who have attended and registered today. So I'll be sending out the recording here a little later on. But yeah, I wanted to open it up. I know we've blown through the hour pretty quickly here, but we'll stick around for a few minutes to answer any questions that may come up. You can either put those into the chat or just come off of mute and ask your questions here. And if you got called away for any reason, again, the recording will be available for you. Again, I absolutely love community pharmacy. I'll do everything in my power to help you be successful. And please reach out to me if you need more details on any one of these programs, or directly to the presenter today who's left their contact information in the chat. For those who are seeing this on YouTube, we'll put that contact information in the notes below as well. And we're here to help any way we can. Thanks again for your viewing and participation today.